So, today we are discussing about larynx. Larynx, it is an organ of phonation and respiration, and it protects the lower respiratory passages. It protects the lower respiratory passages, and it allows only the entry of air, and it doesn't allow any foreign particles. Okay, so the larynx, says this is the larynx. So this is the larynx. It is a organ of phonation and respiration. It is an organ of phonation and respiration, and it acts as a watchdog to protect the lower respiratory passages, from any foreign particles, and it allows only air. Okay, so this is the larynx. So the larynx extends from the laryngeal inlet. The larynx extends from the laryngeal inlet to the lower border of cricoid cartilage. So the larynx extends from the laryngeal inlet to the lower border of cricoid cartilage. So this is the larynx. It lies opposite the vertebra C2 to C6. It lies opposite the vertebra C2 to C6, and in children it lies opposite the vertebra C1 to C4. In children it lies opposite the vertebra C1 to C4, and the growth of the larynx and in females is not more. When compared to males, the growth of the larynx in females is very much less, and it is compared to that of the children. That is, females voice and children voice are very much similar. They are high pitched voices. And coming to the female, in males, the growth of the larynx is seen in the Adam's apple, because we can see the deep voices in females because of the presence of Adam's apple or the laryngeal prominence. It is presence of the Adam's apple and the laryngeal prominence in the characteristical pubertal growth. So today we are discussing about larynx, and the larynx, it is an organ of phonation and respiration, and it protects the lower respiratory passages and acting as a watchdog, and it doesn't allow the entry of any foreign particles, and it allows only air. Okay, so coming to the larynx lies opposite the C3 to C6 vertebra in adults and C1 to C4 vertebra in children. This lies opposite the C3 to C4 vertebra, C6 vertebra in adults, and it lies opposite the C1 to C4 vertebra in children. And the growth of the larynx in females is comparatively low when compared to the males, and thus why it is similar to that of the children. In females, the growth of the larynx is similar to that of the children, and this why the children's voice and the female's voice are the similar, that is a high pitched voice. And coming to the males, the growth of the larynx is during the puberty. The growth of the larynx is very much seen by the formation of Adam's apple or laryngeal problems. That's why their voice is deep. Okay, because of the Adam's apple and laryngeal prominence, because of the growth of the thyroid cartilage, the Adam's apple and laryngeal prominence can seen a characteristical pubertal growth, and thus why their voice is very deep. Okay, so I'm coming to the measurements of the larynx. The vertical measurements in males is about 46 and females is about 36 in females. Vertical measurements in males is about 44 mm in males and 36 mm in females, and transverse is about 43 mm in males and 41 mm in females, and anteroposterior is about 36 mm in males and 26 mm in females. Okay, coming to the larynx. So the larynx, we know that it extends from the laryngeal inlet to the low border of cricoid cartilage. Okay, it extends from, this is the cricoid cartilage. This is the cricoid cartilage. When we take the section of the larynx, so this is the cricoid cartilage and this is the thyroid cartilage. Okay, and this is the posterior lamina of the cricoid cartilage. This is the posterior lamina of the cricoid cartilage, and this is arytenoid cartilage, and these are coniculate and cuneiform cartilages. Okay, so coming to the larynx, the larynx consists of 3 paired cartilages and 3 unpaired cartilages. Okay, and the paired cartilages are arytenoid, coniculate and cuneiform, and the unpaired cartilages are epiglottis, thyroid and cricoid. So the larynx consists of 3 paired cartilages and 3 unpaired cartilages. Totally we have 9 cartilages are present in the larynx. 9 cartilages are present in the larynx. Out of these 3 are paid and 3 are unpaid. Okay, what are the 3 paid cartilages? The 3 paid cartilages are the arytenoid, corniculate and cuneiform. And the 3 unpaid cartilages are epiglottis, thyroid cartilage and cricoid cartilage. Okay, so the larynx consists of 9 cartilages. Out of these 3 are paid and 3 are unpaid, and 3 unpaid cartilages are the epiglottis, thyroid and cricoid cartilages, and the paid cartilages are the arytenoid, corniculate and cuneiform cartilages. And also we have seen many more, and we can see intrinsic muscles of larynx are present which are connected to these cartilages, and also we can see cricovocal membranes and thyroid membranes are seen. Cricovocal membranes, quadrate membranes and thyroid membranes are seen in the larynx, and we can see these cartilages, they are united by the synovial joints. So the larynx consists of these cartilages and the intrinsic muscles, and these cartilages are united by ligaments, and also these cartilages, they are joined by the synovial joints. So all these things, they are seen in the larynx. Okay, coming to the cartilages. So we can see the first we will discuss about epiglottis. Okay, so the epiglottis is a leaf-like cartilage, and and it is made up of elastic cartilage, and all the cartilages of larynx are made up of hyaline. All the cartilages of larynx are made up of hyaline except epiglottis and some part of arytenoid, cuneiform and corniculate cartilages. Corniculate and cuneiform cartilages, they are made up of elastic fibrocartilages, and the remaining all the cartilages of larynx, that means thyroid, cricoid and also most of the arytenoid cartilages, they are all made up of hyaline cartilages. So out of these 9 cartilages, epiglottis and some part of arytenoid, corniculate and cuneiform, they are made up of elastic fibrocartilage, and the remaining part of the cartilages of larynx, they are made up of the hyaline cartilage. Due to the process of aging, these cartilages, they some may show made up of hyaline cartilages. So those cartilages which are made up of hyaline cartilages, they may show ossification. Okay, so coming to the epiglottis. So epiglottis, it is a leaf-like cartilage. Epiglottis, it is a leaf-like cartilage. Okay, and consists of upper and lower end. It consists of upper and lower end, anterior and posterior surfaces, and 2 lateral borders. So the epiglottis consists of upper end and lower end, anterior and posterior surfaces, and 2 lateral borders. Okay, coming to the upper end. So the upper end of the epiglottis is covered by the mucous membrane, and it forms the upper boundary of the laryngeal inlet. It forms the upper boundary of, so this is the laryngeal inlet. Okay, this is the laryngeal inlet where the laryngopharynx communicates with the larynx. This is the laryngeal inlet. Okay, this is the laryngeal inlet. So the upper end of the epiglottis, it forms the upper boundary of the laryngeal inlet. Okay, and coming to the lower end of the epiglottis, it is connected to the thyroid cartilage. So this is the thyroid cartilage. Okay, this is the thyroid cartilage. The lower end of the epiglottis is connected to the thyroid cartilage by thyroepiglottic ligament. And coming to the anterior surface, the anterior surface of the epiglottis, it is connected, the upper part of the anterior surface, it is connected to the tongue by, we know that while discussing the tongue, we know that the epiglottis is connected to the tongue by median and as well as lateral glossoepiglottic folds. Okay, so the anterior surface, it is connected to the tongue by median as well as lateral glossoepiglottic folds. The mucus depression on the median epiglottic fold, we call it as vallecula. Okay, this is the vallecula. So and coming to the lateral bone, and coming to the anterior surface, the lower part of the anterior surface, it is connected to the hyoid bone. This is the hyoid bone. Okay, this is the hyoid bone. So the lower part of the anterior surface, it is connected to the hyoid bone by hyoepiglottic ligament. This is the hyoepiglottic ligament. And the posterior surface, it is covered by mucous membrane, and the posterior surface is covered by the mucous membrane, and it forms the upper anterior wall of the laryngeal cavity. It forms the upper part of the anterior wall of the laryngeal cavity. Okay, upper part of the anterior wall of the laryngeal cavity. So the epiglottis is leaf-like and it is made up of elastic cartilage, and it consists of upper end and lower end, anterior and posterior surface, and as well as two borders, two lateral borders. Upper end, this is the upper end, is covered by the mucous membrane, and it forms the upper boundary of the laryngeal inlet. Okay, and coming to the lower end, it is connected to the thyroid cartilage by thyroepiglottic ligament. And coming to the anterior surface, it is also covered by mucous membrane, and it is attached to the tongue by a pair of median as well as a pair of lateral glossoepiglottic folds, by a pair of median as well as lateral glossoepiglottic folds. The depression, the mucous depression on the median glossoepiglottic fold, we call it as vallecula. Okay, and coming to the lateral borders, they are formed by, coming to the lateral borders, they give attachment to the one important fold that is called array epiglottic fold. The lateral borders of the epiglottis, they give attachment to one important fold that is called array epiglottic fold, which gives attachment to array epiglotticus as well as the thyroepiglotticus muscles, which are nothing but the intrinsic muscles of the larynx. Array epiglotticus as well as the thyroepiglotticus muscles. Array epiglotticus as well as the thyroepiglotticus muscle, which is related medially to the laryngeal inlet and laterally to the pyriform fossa. So the array epiglottic fold, medially to the array epiglottic fold, we have laryngeal inlet is present, and lateral to the array epiglottic fold, we have pyriform fossa is present, which is nothing but a mucus depression, of the larynx. Okay, so the epiglottis consists of upper end and lower end, and anterior surface and posterior surface, as well as the two lateral borders. Upper end it is covered by mucous membrane, and lower end it is attached to the thyroid cartilage by thyroepiglottic ligament, and the anterior surface is covered by mucous membrane, and it is attached to the tongue by median glossoepiglottic fold as well as the lateral glossoepiglottic fold. The depression on either side of the median glossoepiglottic fold, we call it as vallecula, and the lower part of the anterior surface, it is connected to the hyoid bone by the hyoepiglottic ligament, and coming to the posterior surface, it is formed by the it is covered by the mucous membrane, and the upper part of the posterior surface and the anterior surface, they are lined by the stratified squamous non-keratinized epithelium, and the remaining part, they are lined by the ciliated columnar epithelium. Okay, and on the lateral borders gives attachment to the array epiglottic fossa, which is epiglottic fold, which extends from the epiglottis to the posterior to the lateral border of epiglottis to the arytenoid cartilage. Array epiglottic fold means epiglottic fold which extends from the lateral border of epiglottis to the arytenoid cartilage. Okay, and the array epiglottic muscle, array epiglottic fold gives attachment to the array epiglotticus as well as the thyroepiglotticus muscles. Okay. And coming to the another cartilage, that is thyroid cartilage. Coming to the next cartilage, we know that three unpaired cartilages are present. They are epiglottis, thyroid as well as the cricoid cartilage. So we will know thyroid cartilage. So the thyroid cartilage, it is quadrilateral in shape. The lamina of the thyroid cartilages are quadrilateral in shape, because thyroid cartilage, it is having two lamina. These are having two lamina, and each lamina, it is quadrilateral in shape and presents upper border, lower border, anterior border, posterior border. Okay, it presents upper border, lower. This is a thyroid cartilage. What I have represented is a thyroid cartilage. It consists of upper border, lower border, anterior border, and posterior border. And also it is having two surfaces, outer surface, and deep to that is the inner surface. Okay. Coming to the upper border, it gives attachment to the upper border of thyroid cartilage. It gives attachment to one membrane. This is called thyrohyoid membrane. This is thyrohyoid membrane. We can see thyrohyoid membrane here also. So this thyrohyoid membrane, it extends from this is the section of thyroid cartilage, and this is the hyoid bone. So the thyrohyoid membrane extends from the upper border of thyroid cartilage to the upper border of the body and greater corner of the hyoid bone. Upper border of the body and greater corner of the hyoid bone. So this is the thyrohyoid membrane. Okay. So The thyroid membrane, it extends from the upper border of thyroid cartilage to the upper border of the body as well as the greater corner of the body of the hyoid bone. Okay, so and this is the thyroid membrane. So the upper border of thyroid cartilage gives attachment to the thyroid membrane, and the lower border in the anterior part, it gives attachment to the one ligament that is called conus elasticus. This is called conus elasticus. Okay. This is the conus elasticus, and the remaining part of the lower border, it receives the insertion of the cricothyroid muscle. It receives the insertion of the cricothyroid muscle. So cricothyroid muscle, it is also intrinsic muscle of the larynx. While discussing the arroepiglottic fold, we know that arroepiglottic fold, it receives the insertion of the arroepiglotticus as well as the thyroepiglotticus muscles. So these are also the intrinsic muscles of larynx. Okay, and cricothyroid muscle is also intrinsic muscle of larynx. And here we can see the lower border in the anterior part gives attachment to a ligament that is called conus elasticus. And the remaining part of the lower border receives the insertion of the cricothyroid muscle. Okay, cricothyroid muscle. And coming to the anterior border, coming to the two anterior borders, they meet in the midline and forms a prominence that is called laryngeal prominence or Adam's apple, which is more prominent in males. It makes an angle of 90 degrees in males and in 20 degrees in females. So laryngeal prominence, it is formed by the anterior border, the two anterior borders of the two laminae, they meet in the midline and forms the laryngeal prominence, or called as Adam's apple, which is 90 degrees in males and 120 degrees in females. Okay, and coming to the posterior border. Posterior border, it receives the insertion of conjoined tendons of palatoglossus, styloglossus and salpingopharyngeus. It's palatopharyngeus, stylopharyngeus and salpingopharyngeus muscles. The posterior border, it receives the insertion of three muscles. The conjoint insertion of three muscles, they are nothing but the salpingopharyngeus, palatopharyngeus as well as the stylopharyngeus muscles. This is the conjoint insertion of the salpingopharyngeus, palatopharyngeus and stylopharyngeus muscles. Okay. Thus about the posterior border, and also the posterior border presents two horns, superior horn as well as the inferior horn. The superior horn, it is attached to the hyoid bone. By lateral thyrohyoid ligament, which is attached to the hyoid bone by a lateral thyrohyoid ligament, which is nothing but the thicket part of thyrohyoid membrane. And coming to the inferior horn, it forms a synovial joint by joining with the cricothyroid, by joining with the cricoid cartilage by forming cricothyroid joint. Here cricothyroid joint is formed. Okay, so the posterior border, it presents two horns, superior horn as well as the inferior horn, and the superior horn, it gives attachment to the superior horn. It gives attachment to one ligament that is called lateral thyrohyoid ligament, and the inferior horn, it joins with the cricoid cartilage by forming a joint that is called cricothyroid joint. And coming to the two surfaces, outer surface and inner surface. Coming to the two surfaces, the outer surface presents on oblique ridge, that is the oblique ridge of thyroid cartilage. It receives the attachment of muscles, that is sternothyroid. This is sternothyroid. This is thyrohyoid. Sternothyroid and styrohyoid, and also this is the place which I have represented with dotted lines. That is nothing but the inferior constrictor of pharynx. It is nothing but the inferior constrictor of pharynx. So this is the inferior constrictor of pharynx. We know that the inferior constrictor of pharynx have two parts, cricopharyngeal part and thyropharyngeal part. So the anterior surface or outer surface, nothing but not the anterior surface, the outer surface, it gives attachment to three muscles, that is sternothyroid, thyrohyoid and inferior constrictor muscle of pharynx. And coming to the inner surface is covered by the mucous membrane and it is lined by ciliated columnar epithelium. It is covered by the mucous membrane and it is lined by ciliated columnar epithelium. So the thyroid cartilage consists of two lamina. Each lamina is quadrilateral in shape and presents four borders: upper border, lower border, anterior border and posterior border, and two surfaces: outer surface which we are seeing here, the outer surface, and the inner surface. Coming to the upper border gives attachment to the thyrohyoid membrane, which extends from the thyroid cartilage, upper border of thyroid cartilage, to the upper border of the hyoid bone, which is separated by a bursa called subhyoid bursa. Okay, coming to the lower border, the anterior part of the lower border gives attachment to a ligament that is called conus elasticus. And coming to the remaining part of the lower border, it resists the insertion of cricothyroid muscle. And coming to the anterior border, the two lamina of the anterior borders of the two lamina, they meet in the midline and form a prominence called laryngeal prominence and Adam's apple, which is more prominent in males, which is makes an angle of 90 degrees in males and 120 degrees in females. Okay, and coming to the posterior surface of the anterior border consists of, it receives the attachment of, this is thyroepiglottic ligament. The posterior surface of the anterior border, we can see here, it receives the thyroepiglottic ligament, two vestibular ligaments. These are the vestibular ligaments, and these two are the vocal ligaments. And from medial to lateral, it receives the attachment of vocalis muscle, thyroepiglotticus muscle, and thyroarytenoid muscle. Thyroepiglotticus muscle and thyroarytenoid muscle. So from medial to lateral, three muscles are attached here. One is vocalis muscle, and the next one is thyroepiglotticus muscle, and the next one is thyroarytenoid muscle. Okay. So that's about the thyroid cartilage. And one more thing is, the posterior border of the thyroid cartilage presents two horns, superior horn and inferior horn. Superior horn gives it is attached to the hyoid bone by lateral thyrohyoid ligament, and the inferior horn, it makes a joint with the cricoid cartilage and forms the cricothyroid joint. And the anterior surface, it receives the attachment of three muscles: stenothyroid, thyrohyoid and inferior constrictor. And posterior surface is covered by mucous membrane and is lined by ciliated columnar epithelium. Okay, so on the posterior surface of the anterior border, we have seen the three ligaments here: thyroepiglottic ligament in the upper part, two vestibular ligaments here, and two vocal ligaments here. And we on either side of the vocal ligaments, from medial to lateral, three muscles get attached here. They are the vocalis muscle, thyroepiglotticus muscle, and thyroarytenoid muscle. And coming to the cricoid cartilage. So this is the cricoid cartilage. So the cricoid cartilage consists of, it is nothing but a signet ring shape. It retains a shape of signet ring shape and presents an anterior arch and posterior lamina. So the shape of the cricoid cartilage is signet ring shape. And presents an anterior arch and posterior lamina. Coming to the anterior arch presents the upper and lower borders and outer and inner surfaces, and upper and lower borders. So coming to the upper border, it presents two lips, outer and inner lips. Upper border presents two lips, nothing but the outer and inner lips. And coming to the outer lip, it gives attachment to one muscle, outer lip muscle. It gives attachment to one muscle, that is nothing but the lateral cricoarytenoid muscle. And the lower lip gives attachment to one membrane, that is called cricovocal membrane. So the upper border of the cricoid cartilage presents two lips, outer lip and inner lip. The outer lip, it gives attachment to lateral cricoarytenoid muscle, and the inner lip it gives attachment to cricovocal membrane. And the cricovocal membrane It is thickened at the upper part, that is called ocal ligament. It is thickened at the upper part, it is called ocal ligament, which is covered by a mucous membrane forming a fold called ocal folds. It is nothing but it is a ocal ligament, which is nothing but the thickened part of the crico-ocal membrane. Okay, which extends from the thyroid cartilage to the tip of the ocal process, which extends from the thyroid cartilage. This is the thyroid cartilage, it extends onto the tip of the ocal process of that. This is the arytenoid cartilage, and this is the ocal process of the arytenoid cartilage. This is the ocal process of the arytenoid cartilage. So the ocal ligament extends from the thyroid cartilage to the tip of the ocal process of the arytenoid cartilage. Okay. And coming to the we know that we have two borders, upper border and lower borders are present. Upper border consists of two lips, and those lips are nothing but the outer and inner lips. So outer and inner lips presence, outer lip gives attachment to the lateral cricoarytenoid muscle, and inner lip gives attachment to the crico-ocal membrane, which is thickened in the upper part, which forms the ocal ligament, which extends from the thyroid cartilage to the tip of the ocal process. And coming to the coming to the lower border of the cricoid cartilage, it is attached to the trachea by tracheal ligament, lateral cricotracheal ligament. Okay, it is attached to the trachea by the lateral cricotracheal ligament. And coming to the posterior, and coming to the outer surface, of the cricoid cartilage, it receives the attachment of cricothyroid. And also cricopharyngeal part of inferior constrictor. It receives the attachment of cricothyroid from in front. It receives the attachment of cricothyroid, nothing but it gives origin to the cricothyroid muscle, and also it gives origin to the cricopharyngeal part of inferior constrictor. Okay. And coming to the posterior surface, posterior lamina. The posterior lamina also presents upper and lower borders as well as the anterior and posterior surface. Upper and lower borders as well as the anterior and posterior surfaces. Coming to the upper border, it makes a synovial joint with the arytenoid. It makes a joint. It is attached to the base of the arytenoid cartilage by forming a joint called cricoarytenoid joint. And the lower border, it is attached to the trachealis muscle. It gives attachment to the trachealis muscle. If the lower border, it gives attachment to the trachealis muscle, and the anterior surface, it is covered by the mucous membrane. And the posterior surface, it presents a median ridge which gives attachment to the tendon of esophagus. On either side of the tendon of esophagus, it gives attachment to posterior cricoarytenoid muscle. Okay, so the cricoid cartilage presents anterior arch and broad posterior lamina. The cricoid cartilage, the shape of the cricoid cartilage is signet ring shape. And coming to the anterior arch, it presents upper border and lower border, and also outer surface and inner surface. Coming to the upper border presents outer and inner lips. So outer lip gives attachment to the lateral cricoarytenoid muscle, and the inner lip gives attachment to the crico-ocal membrane, which is thickened at the upper part by forming the ocal ligament, which is covered by a mucous membrane by forming a fold called ocal fold. And coming to the lower border, it is attached to the trachea by lateral cricotracheal ligament. And coming to the outer surface, it receives the attachment of two muscles. Cricothyroid muscle takes origin from the infront part, and the cricopharyngeal part of inferior constrictor, it takes origin from behind the outer surface of the anterior arch of the cricoid cartilage. And coming to the posterior lamina presents upper and lower borders. The upper border forms a joint with the arytenoid cartilage by forming a cricoarytenoid joint. And coming to the lower border, it receives the attachment of trachealis muscle. We know that the trachea consists of the posterior part of trachea consists of smooth muscle, nothing but the trachealis muscle. And coming to the anterior surface, it is covered by mucous membrane, and posterior surface presents a ridge which receives the insertion of tendon of esophagus. On either side, there is a depressed area which gives attachment to posterior cricoarytenoid muscle. which extends from the posterior surface of the posterior lamina to the muscular process of the arytenoid cartilage. Okay, so that's about the thyroid cartilage, cricoid cartilage as well as the epiglottis. So, coming to the unpaid unpaid cartilages, we know we have already discussed about the unpaid cartilages, and now we will discuss about paid cartilages. They are nothing but the arytenoid, cuniculate and cuneiform. Coming to the arytenoid cartilages, it is the arytenoid cartilage. It presents an apex, base and three surfaces: posterior surface, medial surface and anterolateral surface, and two processes: ocal process and this is muscular process. This is muscular process and this is the ocal process. Okay. So, the apex of the arytenoid cartilage, it is directed above and it forms a joint with the cuneiform, and it forms a joint with the cuneiform cartilage. Forms a joint with the cuneiform synovial joint with the cuneiform cartilage, and the base of the arytenoid cartilage, it joins with the cricoid cartilage to form the cricoarytenoid cartilage. And here we know that here we can see. So this is the posterior view. This is the posterior view of the arytenoid cartilage. Here we can see this is the cricoid cartilage. This is the cricoid cartilage, posterior lamina. On the posterior surface of the cricoid cartilage, we have seen here in insertion posterior surface of the lamina of the cricoid cartilage. We can see the insertion of the tendon of esophagus and also the attachment of the posterior cricoarytenoid muscle, which extends from the posterior surface of the posterior lamina of the cricoid cartilage to the muscular process, from the muscular process of the arytenoid cartilage. Okay, and here we can see the apex. The apex, it also receives the attachment of the oblique arytenoid muscle, which arises from the opposite muscular process to the apex, which arises from the opposite muscles of the muscular process to the apex. Here we can see this is the oblique arytenoid muscle. The apex gives attachment to oblique arytenoid muscle as well as the array epiglotticus muscle. We know that the array epiglotticus muscle lies in the array epiglottic fold, which extends from the upper border of the lateral border of the epiglottis to the epiglottis to the apex of the arytenoid cartilage. Okay, so this is the posterior aspect of the arytenoid cartilages. It presents an apex, base. We know that the apex gives attachment to two muscles: oblique arytenoid muscle, which arises from the muscular process of the opposite arytenoid, and also gives attachment to the array epiglotticus muscle. This array epiglotticus muscle lies in a fold called array epiglottic fold. Okay. These array epiglottic folds, which forms the lateral boundary of the laryngeal inlet, Okay, on either side we have a laryngeal inlet, or either side we have a array epiglottic fold. Okay, so the apex gives attachment to oblique arytenoid muscle. This is the oblique arytenoid muscle, and also this is the array epiglotticus muscle, and the base articulates with the posterior lamina of the cricoid cartilage. We know that this is the posterior lamina of the cricoid cartilage. The base articulates with the posterior lamina of the cricoid cartilage. Okay, and coming to the medial surface, it faces the medial surface of both sides. They face each other and nothing but they covered by the mucous membrane. And coming to the posterior surface of the arytenoid cartilages, they are attached to each other by one muscle. The posterior surface of the arytenoid cartilages, they give attachment to one muscle, that is nothing but the transversus arytenoid muscle, which is the only unpaid muscle of the intrinsic muscles of larynx. Transversus arytenoid muscle. The posterior surface gives attachment to one muscle, nothing but the transversus arytenoid muscle. And coming to the anterolateral surface, so the anterolateral surface involves the vocal process, and the anterolateral surface, it gives attachment to one muscle, that is nothing but the thyroarytenoid muscle, nothing but the thyroarytenoid muscle. The anterolateral surface involves the vocal process, and here with the anterolateral surface, it gives attachment to one muscle, nothing but the thyroarytenoid muscle, and also it gives attachment to one membrane, nothing which is the quadrate membrane. Though the anterolateral surface it gives attachment to one membrane, this is nothing but the quadrate membrane. This quadrate membrane, it is thickened in the lower part by forming a fold called vestibular fold. By forming a, which is no fold or ligament, the mucous membrane covering the ligament by forming a fold called vestibular fold. Okay, then this is the ocal fold. We know that ocal fold is nothing but a formation of the, it is nothing but the thickened part of the crico-ocal membrane. It is nothing but the thickened part of the crico-ocal membrane, and also the vestibular fold, it is the thickened part of the quadrate membrane. Okay. So this is the quadrate membrane. The anterolateral surface gives attachment to thyroarytenoid muscle, as well as it gives attachment to the quadrate membrane. It gives attachment to the quadrate membrane. Okay, and here the quadrate membrane, it is attached in front with the thyroid cartilage. It is attached in front with the thyroid cartilage, as well as the it also attached to the epiglottis. It is attached to the epiglottis, as well as it is attached to the thyroid cartilage, and on posterior aspect it is thickened. The quadrate membrane, it is bounded. It is bounded by a fold called array epiglottic fold. Okay, this is the array which is limited by the fold called array epiglottic fold, and the quadrate membrane, it is thickened here to form a fold called vestibular fold. Okay, this is the vestibular fold, and this is the ocal fold. This is the sinus of larynx. This is the sinus of larynx. Okay, and coming to the so we have been discussed about apex and base. Apex, it gives attachment to two muscles. Apex of the arytenoid cartilage gives attachment to two muscles, oblique arytenoid muscle, and also it gives attachment to array epiglotticus muscle. And coming to the base, it forms a joint with the cricoid cartilage by forming cricoarytenoid joint, and the ocal process and muscular process. And the ocal process, it gives attachment to ocal fold, as well as it gives attachment to ocalis muscle. And anterolateral surface, it gives attachment to a fold called vestibular fold. From the vestibular fold, we have a membrane extended upwards, that is called quadrate membrane. And coming to the muscular process anterior surface, it gives attachment to lateral cricoarytenoid muscle, which extends from the cricoid cartilage to the anterior surface of the muscular process. And also the posterior surface, it gives attachment to posterior cricoarytenoid muscle. The posterior surface of the muscular process, it gives attachment to posterior cricoarytenoid muscle. Okay, we know that the posterior cricoarytenoid muscle, they arise from the posterior lamina of the posterior surface of the cricoid cartilage, and they give attached to the muscular process, posterior surface of the muscular process of the arytenoid cartilage. Okay, and coming to the posterior surface of the arytenoid cartilages, it gives attachment to one unpaired muscle of the intrinsic muscles of the larynx, nothing but the transversus arytenoid. Okay, and coming to the cavity of the larynx, it is so this is the cavity of the larynx. Okay, so the anterior wall of the cavity of the larynx is comparatively more when compared to the posterior wall, because the laryngeal inlet, it is obliquely placed. Okay, when we take the cavity of the larynx, it divides into three compartments. The area above the vestibular folds, we call it as vestibule. The area above the vestibular folds, we call it as vestibules. And here the space, these are nothing but the vestibular folds, and these are nothing but the ocal folds. The space between the two vestibular folds, we call it as rima vestibuli, and the space between the two ocal folds, we call it as rima glottidis. And here the space between the vestibular fold and vocal fold, we call it as sinus of larynx. This is called sinus of larynx, and sometimes a mucous diverticulum extends upwards from the sinus of larynx, and we call it as the saccule of larynx, which consists of oil glands, which consists of more number of oil glands, and it helps in lubrication. This is nothing but the saccule of larynx. This is nothing but the saccule of larynx, a mucous diverticulum extended from the sinus of larynx. So this is called saccule of larynx, and it acts as an oil can which which helps in lubrication. Okay, so then the area below the rima glottidis is called infraglottic compartment, which is nothing but a truncated one. Okay, and coming to the rima vestibuli. And coming to the rama vestibuli, what is the function of rama vestibuli? And this rama vestibuli, it allows the, this we know that these are the vestibular folds. Yes, these are the vestibular folds. This is the vestibular fold and these are the vestibular folds. The rama vestibuli, it allows the inspiration and prevents the air exit by the, so they come together, these four folds, they come together and prevents the air exit that's increase the intrathoracic as well as the intra-abdominal pressure. Thus increasing the intrathoracic as well as the intra-abdominal pressure, and this by increasing the intra-abdominal intrathoracic pressure, this movement helps in defecation, parturition in males as well as the parturition in females as well as the micturition. By increasing the intrathoracic and intra-abdominal pressure, it is useful for defecation, micturition as well as the parturition in females. So what is the function of rama vestibuli? So the space between the two vestibular folds, we call it as rama vestibuli. And what is the function of rama vestibuli? Means the rama vestibuli, it allows the inspired air and prevents the air exit. So it acts as an exit valve. Thus increasing the intrathoracic as well as the intra-abdominal pressure. Okay, so this intrathoracic and intra-abdominal pressure helps in defecation, micturition as well as the parturition in females. Okay, and coming to the rama glottidis, the rama glottidis consists of two parts. The rama glottidis consists of two parts. Intramembranous part, the anterior 3/5 is the intramembranous part and the posterior 2/5 is the intracartilaginous part. The space between the two vocal folds, we call it as rama glottidis. So during normal inspiration, this rama glottidis consists of, this one is the intramembranous part, anterior 3/5, and this is the intracartilaginous part which measures about posterior 2/5. So this is the structure of the rama glottidis. Okay, what happens during deep inspiration? What happens during deep inspiration is the adduction of the vocal folds. These are the vocal folds, right? So this is the vocal folds, because the space between the vocal folds, this is called rama glottidis. We know that. So the adduction of the vocal folds takes place. And here what happens is, here the rama glottidis becomes triangular. The adduction of the vocal folds takes place and here the rama glottidis becomes triangular. Okay. And what happens during high pitched voice? What happens during high pitched voice is, during the high pitched voice, the adduction of the vocal folds takes place. The adduction of the vocal folds takes place means here the vocal folds, the adduction of the vocal folds takes place here. Okay, and what happens during deep inspiration? Deep inspiration, what happens is, the abduction of the vocal folds takes place in deep inspiration and the adduction of vocal folds takes place in high pitched voices. And coming to the whispering voice, what happens in whispering voice is, here what happens here is the intramembranous part, the vocal folds here, they undergo adduction and the intracartilaginous part, it undergoes abducted. Okay, so the intramembranous part, it undergo adduction and the intracartilaginous part, it undergoes abduction. Okay, during whispering voices, during normal respiration, it appears like this. Okay, and what is the function of the rama vestibuli? Rama vestibuli, what allows here is it allows the exit of air and prevents the inspiration. It allows the expiration and prevents the inspiration, which helps the some of the inspiratory muscles like pectoralis major and also some pectoralis minor muscles. So it allows the expiration of air and prevents the inspiration by the vocal folds, they come together and they doesn't allow the inspired air to come in, and it allows the expiration of air, just opposite to that of the action of the rama vestibuli. Okay, and coming to the nerve supply of larynx, the mucous membrane of the larynx above the vocal folds, it is supplied by the internal laryngeal nerve, and below the vocal folds, it is supplied by the recurrent laryngeal nerve. And one more thing is, all the intrinsic muscles of the larynx, they are supplied by the they are supplied by the recurrent laryngeal nerve, except cricothyroid, which is supplied by the external laryngeal nerve. Okay, and coming to the blood supply of larynx, the area above the vocal folds is supplied by the superior laryngeal artery, and the area below the vocal folds is supplied by the inferior laryngeal artery. And coming to the lymphatic drainage, the area above the vocal folds is drains into jugulodigastric group of lymph nodes, and the area below the vocal folds is drains into pretracheal as well as the paratracheal group of lymph nodes. So the larynx, we have discussed the intrinsic muscles of the larynx as well as the synovial joints of the larynx, as well as the cartilages of the larynx. Okay, so the larynx is about the larynx, so the larynx extends from the upper border of the epiglottis to the lower border of cricoid cartilage, and it consists of 3 unpaired cartilages as well as the 3 paired cartilages. Unpaired cartilages include epiglottis, thyroid cartilage and cricoid cartilage, and the paired cartilages include corniculate, cuneiform as well as the arytenoid cartilages. And one more thing is, these corniculate and cuneiform cartilages, they are situated in the array-epiglottic fold, thus maintain the tension of the fold, thus prevent the bolus of the food entering into the laryngeal inlet. They maintain the tension of the fold, they maintain the fold into straight, they maintain the fold in the upright position. Corniculate and the cuneiform, corniculate as well as the cuneiform cartilages, they are present within the array-epiglottic fold, So in the array-epiglottic fold, we have array-epiglotticus muscle is present, thyroepiglotticus muscle is present, as well as the corniculate as well as the cuneiform cartilages are present in the array-epiglottic fold, which forms the lateral boundary of the laryngeal inlet. And the array-epiglottic fold medially related to the laryngeal inlet, and lateral we have pyriform fossa is present. Okay, so that's about the larynx, and that's about the blood supply of the larynx. Intrinsic muscles of the larynx we have discussed. We have discussed about lateral cricoarytenoid, posterior cricoarytenoid, oblique arytenoid muscles we have discussed, and array-epiglotticus, thyroepiglotticus, transversus arytenoid we have discussed. These are all the intrinsic muscles. Cricothyroid, these are all the intrinsic muscles of the larynx. So we have discussed about larynx regarding its cartilages, intrinsic muscles, synovial joints, how it forms the synovial joints with the other cartilages, how they are united by the ligaments, and the blood supply, nerve supply, as well as the lymphatic drainage. Okay, so that's about the larynx.